Imagine finally falling asleep after a long day. Your body relaxes, your breathing slows, and you begin to drift into deeper sleep. Suddenly, you wake up with pressure in your bladder. You check the clock and realize it is the middle of the night. You get up, walk to the bathroom, and try to fall asleep again. But then it happens again later in the night. For millions of people around the world, this pattern is very familiar. Waking during the night to urinate is extremely common, especially as people grow older. In medical terms, this condition is called Nocturia. While occasional nighttime urination may not be a problem, frequent awakenings can disrupt sleep, reduce daytime energy, and affect overall health. As a urologist, I often see patients who believe this condition is simply a normal part of aging. While aging can play a role, there are usually specific reasons why nocturia occurs. Understanding those reasons is the first step toward improving sleep and restoring comfort. What is nocturia? Nocturia refers to waking from sleep one or more times during the night to urinate. Doctors typically consider it clinically significant when a person wakes 2 or more times every night to empty the bladder. Repeated sleep interruptions can lead to fatigue, poor concentration, irritability, and reduced quality of life. For older adults, frequent nighttime bathroom trips can also increase the risk of falls or injuries. Healthy sleep is essential for the body's repair processes, hormone balance, and brain function. When sleep is disrupted repeatedly, the effects can extend far beyond the bladder itself. How the body normally controls urine at night. The human body follows a natural daily rhythm controlled by the brain and hormones. During the night, the brain releases antidiuretic hormone, often abbreviated as ADH. This hormone signals the kidneys to produce less urine while a person sleeps. Because of this mechanism, most people can sleep several hours without needing to empty the bladder. However, when this hormone system becomes less effective, the kidneys may produce more urine than usual during the night. This condition is known as nocturnal polyuria, and it is one of the most common causes of nighttime urination. Aging, medications, and certain medical conditions can interfere with the body's ability to regulate this process. Fluid intake before bedtime. One of the most obvious contributors to nocturia is drinking large amounts of fluid before bedtime. When liquids are consumed late in the evening, the kidneys continue filtering that fluid during the early hours of sleep. Certain beverages make this problem worse. Caffeine acts as a mild diuretic that stimulates urine production and can irritate the bladder lining. Coffee, tea, soda, and energy drinks may therefore increase nighttime urination. Alcohol also disrupts the hormone system that normally reduces urine production during sleep. As a result, people often wake several times during the night after drinking alcoholic beverages. Overactive bladder. Another frequent cause of nocturia is overactive bladder syndrome. In this condition, the bladder muscles contract more often than they should, even when the bladder is not completely full. People with overactive bladder may feel sudden urges to urinate, experience frequent urination during the day, or wake several times during the night to use the bathroom. The causes can include nerve signal problems between the brain and bladder, bladder irritation, certain medications, or age-related changes in bladder tissue. Enlarged prostate in men. For many men, nighttime urination is closely related to prostate health. The prostate gland surrounds the urethra just below the bladder. As men age, this gland often grows larger in a condition known as benign prostatic hyperplasia. When the prostate enlarges, it can partially block urine flow. The bladder must work harder to push urine through the narrowed passage, which can make the bladder more sensitive and cause more frequent urges to urinate both during the day and at night. Sleep disorders. Sometimes the bladder is not the main issue. Sleep disorders, particularly obstructive sleep apnea, can contribute significantly to nighttime urination. Sleep apnea causes repeated pauses in breathing during sleep. These interruptions activate the brain and prevent deep sleep. When the brain briefly awakens, a person becomes aware of bladder signals that would normally be ignored during deep sleep. In addition, sleep apnea can alter hormone levels that regulate urine production, increasing nighttime urine output. Medical conditions linked to nocturia. Certain medical conditions can also lead to increased nighttime urination. Diabetes, kidney disease, urinary tract infections, and heart problems may all influence the body's fluid balance. For example, Fluid may accumulate in the legs during the day in people with certain cardiovascular conditions. When lying down at night, this fluid re-enters the bloodstream and is filtered by the kidneys, leading to increased urine production. Because of these possibilities, persistent nocturia should be evaluated by a healthcare professional. Practical ways to reduce nighttime urination. Many cases of nocturia can improve with lifestyle changes. Reducing fluid intake 2 to 3 hours before bedtime can help prevent excess bladder filling during the night. Limiting caffeine and alcohol in the evening can reduce bladder irritation. Elevating the legs during the evening may help redistribute fluid earlier in the day rather than at night. Bladder training techniques may also improve bladder capacity and reduce urgency over time. Maintaining a healthy weight, staying physically active, and practicing good sleep habits can also support urinary health. When to seek medical advice. Occasional nighttime urination is normal, but frequent awakenings should not be ignored. Individuals should consult a doctor if they regularly wake more than twice per night to urinate, experience pain during urination, notice blood in the urine, or have difficulty emptying the bladder. A healthcare professional may perform urine tests, bladder scans, or prostate evaluations to identify the underlying cause. Treatment options may include medications, lifestyle adjustments, or management of underlying health conditions. Conclusion: waking up during the night to urinate is a common experience, but it is not something people must simply accept. Understanding the causes of nocturia allows individuals to take practical steps to improve sleep and bladder health. By adjusting evening habits, maintaining healthy lifestyle practices, and seeking medical guidance when necessary, many people can significantly reduce nighttime bathroom trips. Better sleep leads to better physical health, clearer thinking, and improved overall well-being. Addressing nocturia is therefore not only about bladder health. It is about restoring restful nights and improving quality of life. If you found this video helpful, don't forget to like, subscribe, and hit the bell icon so you never miss an update. We've got plenty more real talk on men's health coming your way. Thanks for watching, and we'll see you in the next video.